pee when you laugh, run or jump? You've probably heard some information about doing your Kegels, but how do you know if you're doing them right? And how do you apply the right techniques to other exercises to help strengthen your pelvic floor and stop urine leaks? It's important to remember that there's a lot more to pelvic floor training than just squeezing. A pelvic floor that works needs a full body solution. So first, how do you do a Kegel or pelvic floor exercise correctly? Weakened pelvic floor muscles can cause leaks. These muscles support the bladder, uterus and bowel and help to control how and when you pee. Now, the first way to start reducing bladder leaks is to do your pelvic floor exercises, but how do you get them right? So try to locate and connect with the 3 zones of your pelvic floor muscles. That means your urethra at the front where you pee, your vagina is in the middle, your anus where you poop from is at the back. Try gently lifting and squeezing the muscles around each opening. Focus on the back passage first. Imagine you're trying not to pass wind or fart. That's your pelvic floor. You shouldn't be squeezing your glutes, the big muscles of your buttocks, just the don't fart muscles. Try and do this on an out breath as you exhale. Now find the middle, the muscles of your vagina. Imagine drawing a tampon further up inside you as you gently exhale, or sucking a thick smoothie up through your vagina like it's a straw. And the front, lift as if you're trying to stop a wee. All these will help you find and engage your pelvic floor muscles. Be aware of not clenching your glute or butt muscles or squeezing your inner thighs. It should be more of a deeper, subtle movement. Breathe in deep to the back of your ribcage and then exhale as you lift your pelvic floor or imagine you're stopping that fart. MUTU System is clinically proven to improve pelvic floor muscle function and strength, tried and tested by more than 100,000 moms.